Hey, good morning everyone. We're going to talk about my article that is a case report, and it is titled Treatment of an Adolescent Patient with Class 2 Division 1 Malocclusion by Extraction and Forces Fatigue Resistant Device. So first of all, the introduction. Let's recall some characteristics and some clinical manifestations of a Class 2 Division 1 patient. As we know, this patient has a Class 2 molar relationship according to Engel's classification. Also Class 2 cane relations according to Engel's classification. Maxillary incisors incline forward, as we can see here on the right image. There is a severe discrepancy of the upper and lower arches. Also, the patient will have increased overjet, convex facial profile, and incompetent lips, meaning lips that are unable to fully close. So here we have the case report. It's a 14-year-old female patient who presents with a Class 2 skeletal base resulting from a retruded mandible and a protruded maxilla. And these characteristics along with dentoalveolar biprotrusion. Also, as we can see here on the right images, the patient presents mesocephalic head and mesoprosopic facial form. And here on the right images, the convexity of the profile is in a good illustration. Also, we can see the competent lips and the acute nasolabial angle. So now on the intraoral examination, we have a Class 1 molar relation on the right side and a Class 2 relation on the left side. Procline upper and lower anteriors with an overjet of 4 millimeters. Crowding on 11, 21, 31, and 41. And a posterior monodentary crossbite on 36. Also here on the right image, we can see the biprotrusion like very expressed on this patient. So here we have the cephalometric X-ray. The cephalometric analysis revealed orthognatic maxilla and retrognatic mandible. On the panoramic X-ray, these X-rays showed partially erect mandibular third molars and congenitally missing maxillary third molars. Also, there was no evidence of cavities, restoration, or other pathologies on these X-ray. So, regarding the treatment of this patient, since this patient have biprotrusion and crowding, the treatment approach involved the extractions of 4 first premolar teeth, followed by the implementation of a hybrid functional device that is called the Forsus Fatigue Resistant Device. So they began with the extraction of the 4 first premolar teeth, 14, 24, 34, and 44. Then they began with all the alignment and all the first phase of the treatment with a 0.022 slot prescription MBT were carried out using also the arch wires 0.016 niti, following 0.018 stainless steel 17 by 25 niti, and finally 19 by 25 stainless steel. The space closure was carried out using active tiebacks on the continuous arch wire 19 by 25 stainless steel. So here on the right image, we also can see all the fixed appliances and the biomechanics used to the mass retraction of the anterior segment. So the extraction spaces were closed after 6 months, and then the second phase of the treatment was initiated. That was the forces fixed resistance appliance. So this device, as I said, is a functional hybrid device. It has a push rod. A push rod is like an elastic module that will connect to the lower arch distal to canines, as we can see here on the right image. And the spring, on the other hand, will connect to the buccal tube on the maxillary first molar band. Here on the right side, we can see the initiation of the forces fixed functional appliance therapy. And the mechanism of this device is that it exerts pressure on the mandible, causing it to move forward, and it will stimulate the adaptive growth in the mandibular condyle and the remodeling of the glenon fossa. As a result, there is a notable increase in the effective length of the mandible, and also we will see in the extraoral photos the correction of the convexity of the profile of the patient. So the main functions of this device, this forces resistant device, are, first of all, limiting the sagittal maxillary growth, promoting the mandibular growth, inducing mesial movement of the mandibular arch, and a distal movement of the maxillary arch. But this device have a negative point, a side effect that is a very important side effect, and is the forward tooth movement of the lower incisors, meaning the proclination of the lower incisors. So here we have the treatment results. As we can see, there is a noticeable improvement in both the facial aesthetics and the occlusion of the patient. On the post-treatment extraoral photographs, we can see that the convexity of the profile was reduced. There was a remarkable improvement in smile aesthetics. Intraoral assessment revealed bilateral class 1 molar and canine relationships, along with a satisfactory intercuspation in the posterior and the anterior areas. And all this with the complementation in the panoramic X-ray. This panoramic showed a satisfactory root angulation and parallelism on the roots of the teeth. So here we can see the X-ray development of the treatment. The first image is pre-treatment, the second is on the treatment, and the third one is post-treatment. So we can see the transition of a class 2 skeletal base to a class 1 relation on the skeletal basis. Okay, continuing with the discussion. So basically what we saw in this case report was regarding the extractions. We saw that for the correction of dentoalveolar biprotrusion, and this along with a moderate to severe crowding, the extraction of permanent teeth will be required. In this case specifically, the extraction of the four first premolars improve or give the space for the correction of the incisor inclination, and this allowed the desired amount of forward positioning of the mandible. And on the other side, we saw this device, this functional hybrid device, that is the forces fatigue resistant. It is categorized as a fixed hybrid functional appliance It provides flexibility to the mandibular positioning. As I said, it will push the upper molars distally and the lower molars medially to correct the sagittal relationship of a class 2 patient. And this mechanism is made while maintaining the vertical dimension of the patient. But it has a negative point that we have to take into account, that is the tendency to proclaim the lower incisors. And to conclude, finally, to effectively address the class 2 malocclusion caused by retrognatic mandible and bidental protrusion, this hybrid functional device was employed alongside with the extraction of the first premolars, and the premolar extractions created the necessary space for achieving proper tooth inclination and eliminated any obstructions that were presented to the mandibular advancement.